create like an in-season program, was make it, so it'll be a 6-month program that we're offering at Nutriformance. And so I'm going to have to adjust it based on the season because I don't know what race season is going to look like, but we're just going to talk about some basics. See if this will, okay. So some common injuries result from either anatomy in your body mechanics, training, bike fit, or proper shoe wear. So we're going to first talk about the anatomy and the body mechanics. So first thing is your top half. So scapular stabilizers are those muscles that attach at the base of your head all the way to the bottom of your shoulder blades. And so these are important for posture, obviously, but they also correct a lot of movement of the shoulders with any kind of overhead movement like swimming or throwing, but it's also important for decreasing numbness into your hands, maybe when you're riding as well, or that head protruding too far forward because we sit in front of a computer for too long. So the shoulder blade does a lot of different motions, but some of the big things I find are they either have trouble moving up and elevating, moving down and depressing, moving in together, retraction, or posterior tilt, meaning that they move back. A lot of us are just rounded forward habitually because of our jobs and because of cycling. And so some of that's into our thoracic spine too. And so we always have to address whether the thoracic spine can move into extension when we're trying to work on the shoulder blades as well. And so just problems associated, obviously different types of pain, shoulder pain, upper back, limiting your shoulder mobility if you can't get your arm all the way up or reach an overhead cabinet, poor power generation with your swimming stroke, poor posture, impingement of the shoulder, just like pinching pain on the front, any kind of rotator cuff strain, tendinitis, weakness, neck and chest tightness, elbow or wrist pain. Whenever the foundation starts to crumble, then things are going to have problems further down the chain. So shoulder, elbow, wrist, thumb, and then also just positioning on the bike. So we're going to start moving our way down towards the lower half. So we're going to get into the gluteus medius. So this is important because this is one of your pelvic stabilizers. So it's what helps keep the pelvis in alignment with any kind of single leg activity. So whether you're running, cycling, jumping, doesn't matter what it is, at some point or another, you're supporting yourself with one extended leg and one bent leg. And so this is what helps prevent that knee from caving in, or maybe your arch from dropping on your foot. And then there's normal movements that should happen when you walk, and then there's abnormal movements that can be assessed, obviously. And so just some problems that are associated with a weak glute med, ITBN syndrome, bursitis, poor form with running, knee alignment with cycling, decreased stride length with running, hip, knee, low back pain. All of those things can come from that glute med weakness, which is why it's so important to strengthen. Even in season, there's basic things that you can do. And so as we go lower towards the knees, we've got this lower body alignment. And so I like this picture because it kind of shows you that knock-knee position, that genu valgum, what normal should look like, and then genu varum, kind of the cowboy bow-legged position. And so knock-knee, you're putting a lot of strain and pressure on the inside of the knee joint, whereas if you're bow-legged, you're putting a lot of strain and compression on the outside of that knee joint. And so different things can be weak, different things can be tight, and then it can also contribute to poor kneecap alignment. And so when you're cycling, I think almost everybody here is clipped in. And so you've got a fixed point between your pelvis, your hands, and your foot. And so if that cleat isn't in the right position, that can contribute to some knee issues as well. So just something else to think about. As important as muscles are, also positioning on the bike is important. So we're going to go through just some exercises on how to correct some alignment. So the first one is a hip adduction exercise, that picture. And so that's working on inner thigh strength. The important thing here is that you're not winding up your fascia on the side of your body so that you're not lifting your neck. And that goes true for the bottom one too, or you're not side bending from your spine. And you're keeping that knee straight without bending that knee, and that foot is flexed. So that's that first one. The bottom one is the hip abduction. And so this is where you're really trying to work that gluteus medius. So this is your medial and lateral chain pelvic stabilizers. So again, you want the head and neck relaxed, not pulling up and winding up that fascia. You want the trunk relaxed, core stabilized. And then you want to be able to bring that leg up and back in a little bit of a diagonal to work more of those posterior muscle fibers. So some of this is structural and some of this is muscle, but some of this too kind of goes into your shoe. If you're running or walking or just moving about on a normal daily basis. And then the other part of it is that shoe pedal interface. And also orthotics may come into play depending upon your alignment. So this is how you strengthen in that side plane motion. And then a lot of times, I don't want to go too far in depth with this leg length discrepancy, but it can cause spine, pelvic, hip, outer and inner knee pain. And leg length can be true. It can be a structural problem, or it can be a functional problem where there's a muscular imbalance. The pelvis may also be rotated. So the SI joint is the most stable joint in the body. There is only 3 degrees of motion. So when patients come in and tell me their pelvis is out of place, I really wonder what they're thinking. So a lot of times with athletes, and not just athletes, but people in general, we favor one side of our body. So a lot of people will kick their hips out to one side. They'll favor standing on one leg versus the other. They clip in all the time with one foot. When they're swimming, they breathe to one side. When they're reaching in their pocket, they reach more to one side of their pocket. When they're running, they'll step with the first leg and power through that leg. And so that can create some imbalances. And so the big thing is just to try to balance yourself back out. So we're going to kind of get into how to fix this functional leg length problem, which is what most people have. So there's an easy thing you can do. You can get measured and assessed by a PT, right? But you could also just do some asymmetrical strengthening. I think most athletes have good self-awareness of their body to be able to determine which side feels weaker or less coordinated when they do an exercise. So if you do 20 straight leg raises on one leg and then do 20 straight leg raises on the other leg, pay attention to which side feels weaker or less coordinated. And that's the side that you should do circles on, clockwise and counterclockwise. Forgive my misspelling in there. But this is something that I will easily give people in the clinic to go over. It does not take more than 20 reps for any athlete I've ever worked with to feel fatigue on one side versus the other. Even the Olympic athletes that I've worked with were shocked at how tired their leg felt just doing 20. So that will work on the front, your hip flexors. Then you need to address the back, your glutes. So I like to use a single leg bridge unless you have some kind of back pain issue, surgery, or some other concern. Then we might find a different exercise. But just in general, single leg bridge, if you do 10 on the right and 10 on the left, pay attention to which side feels weaker or less coordinated and just do an extra set of 10 on that weaker or less coordinated side. Now understand, if you're doing these week to week to week, right, your training differs, what you're doing differs. So it might not always be the same side that feels weaker or less coordinated. So just adjust it as needed. If you feel like you're not capable of doing this on your own, I'm happy to try to help you. So as we go further down the chain, we're going to talk about the feet. So if you're flat-footed, you can see on this picture what happens to those ankle bones and how that foot goes out. What you can't see is higher up, the knees are going in and the hips are going out. So it's going to make for tighter outer lower legs just because that tissue is being overstretched. It's also going to create some weak pelvic stabilizers and some weak arch muscles intrinsics. So there are some different exercises that you can do to try to correct that. Just real basic things that I like to give people are working on the gluteus medius. So we already saw from the previous slide an exercise. Another one is sidestepping. You can work on towel slides and kind of arch scrunches, if you will, creating like a shorter foot. And then ankle inversion isometric exercise as well. Now, if your foot is as flat as this person's is, it may be worth getting a consult from a physical therapist or orthotist about discussing orthotics. And then what we do as bike fitters may include an orthotic inside the shoe and may not. It may include wedging on the outside of the cleat. So it just depends on what's going on and what we see, how we adjust that. Make sure you strengthen those pelvic stabilizers. And then if you're still struggling, obviously see a PT to correct any kind of asymmetries that are going on. And so this is just, I like these wheels and how they kind of show you alterations in a pedal stroke and what muscles are important on what part of that pedal stroke. So with training, we can have some different issues. There can already be muscle weaknesses going into training that create problems. Overtraining can create some problems, and it can transfer stress up and down the body, depending upon what's going on. So we're going to get into that a little bit more. So when you're training, just be careful of rapid increase in distance or intensity because that can cause muscle tightness or microtrauma. So obviously having a coach like Jim would be good at helping you formulate a plan and how to carefully increase that distance or intensity. Be careful of excessive hill work, especially if your body is not ready for it, because it can create patellar, kneecap tracking issues. And I've seen this from more than 10 patients. Pushing too high of a gear can cause increased stress on the inside of the knee. Hill running can cause tight quads, inner knee pain, and stress to that. Deep leg squats, just be careful of that, especially with your form, because it can create increased stress on the spine and lower body. Jumping with poor alignment reinforces muscle weakness and tight and flexible muscles. And I'll say doing anything with poor alignment reinforces muscle weakness and tight and flexible muscles. So there are some external factors, obviously a bike fit and proper shoe fit and wear. And I'll do that once we get off the slides. I can show you a couple of tips on how to pick the right shoe. And this is just kind of a picture of like a bike fit and what measurements are important that not everybody thinks about on a day-to-day basis. But, you know, just like an orthotic can correct alignment in a standing person, so can wedging when used correctly on a cyclist. And then this just kind of goes into bike fit, shoe wear. It can correct just different misalignments in the hip, knee, spine, calf and Achilles pain, foot pain, and kneecap tracking issues. And so that is the end of the presentation that I have. So do you guys have any questions?
Okay, let's go. Come on.
Hi, Jen.
Hi, David.
I'm 61 and a half and a cyclist for a number of years, and I'm concerned about having weaker bones as I age. And I understand that pounding, or I don't do running. I know that that type of exercise is good for your bones and for the development of strength in your bones. I don't want to get a broken hip or fall and break my hip and be out from gym for a few years. And is jump roping good to help the bones? And also, what other exercises in reference to impact would you recommend?
Why do you do that?
So I think the big thing with preventing osteopenia and osteoporosis and helping bone remodeling, no matter our age, because bones stop developing at 21 years old, is weight bearing. And so a lot of people don't weight bear on their arms at all. So any type of strengthening is going to help with that bone remodeling. But yoga and Pilates are really great exercises because you get to weight bear from your hands and arms as well. So those are usually my recommendations. Strength training is great because it's any type of vibration. So it doesn't necessarily need to be jumping and pounding. It just needs to create vibration within your body. So sometimes just doing a deadlift, even with just a stick, can create that vibration for your bones to remodel. Does that help you? The cardiovascular stuff isn't really going to help those bones. Swimming, running, cycling, none of that's going to help the bone development.
But just by doing a squat lift will give your bones the vibration and the necessary action to continue the development of them.
For your lower body, yes.
Okay, thank you.
You're welcome. Anybody else?
Come on.
All right. I'm going to go grab a couple shoes just so I can show you some differences and how to pick out some shoe wear. So give me 1 second and I'll be right back.
So Fran, ask her about sizing.
I may have been wearing shoes that were a little too big.
Only,
Oh, yeah.
only 2 sizes.
Hence some knee pain.
Oh, wow.
Yeah, I didn't realize.
Oh, wow.
That would do it.
Yep.
All right. So the big thing that I've been seeing a huge pattern of is a lot of foot pain and a lot of plantar fasciitis. And I think it's because shoe manufacturers are making shoes that do not serve people anymore. And so the big thing is making sure that the shoe allows your big toe to move. Okay. So when you're looking at a shoe, you want to push up on the front of the shoe and see where that bends. And I don't mean a gentle nudge. I mean crank it back and see what happens, okay? And then you want to pay attention to where that bend is, and is that in line with your big toe, okay? Because if you crank the shoe back and it bends here in the middle of your foot bones, it's not serving you, okay? The other thing is the stability on the inside and the outside. And shoes will wear down over time. And this one has a nice hole in it. I don't know if you can see that. So it's got some wear. But when you push on the back, there shouldn't be movements on the sides, okay? So if it's a nice stable shoe, it's not gonna wiggle like that. So this is a perfect shoe, okay? Here is another one. So when I take the shoe and I crank it back, we're gonna pay attention to where it bends and whether or not it bends at the big toe. Okay. And then when you push on the back, so this is a lightweight one, you can see how it just gives, right? So this probably isn't a very good stable shoe. Now, this is an ultra trail running shoe. So it's lightweight. So that's why you're going to see some of that, but this would not be a good one. I went and grabbed Dan's because he never lets me check them. So you're going to crank it back, see where it bends right at the big toe. So we're passing all the tests, at least for the big toe in this house. And then the back doesn't wiggle, and there's no wiggle. Okay. So those are just some things that you can look at to make sure that when you're in your shoes every day, that they're supporting your body. Any other questions?
No questions really, but I can vouch for those single leg bridges. You had me do those like a year ago or something, and I'm still doing those, and they work.
Good. I'm glad to hear that. It's a good maintenance routine. Research shows twice a week will maintain strength. 3 times or more will build strength. So if you're happy with where you're at, do stuff twice a week. If you want to be stronger, more stable, you need 3 times or more.
Can you add that for in season versus out of season? As far as, would you do it 3 times a week in season?
I would, and that's the program that I designed. For anyone who's interested, I'm happy to offer that to you guys too. We did a 6-month, $75 special, and it's with Team Builder. So you just use the app and look at the video, and it's already got predetermined sets and reps on it. But yes, I have set it up for 3 times a week. The exercises, there's a couple people on here doing it. They took me about 25 to 35 minutes to get through. So it's not like you're devoting a large amount of time to it. Now, if you don't know any of the exercises, it might take you 50 minutes to look through all the videos. But yes, I would still, like, if I was doing the straight leg raises and single leg bridges, I would still try to do those 3 times a week.
Thank you.
You're welcome.
Jen, I had a client come in and she was getting pain on the outside of her shin bone when she would run off the bike. Have you ever seen that before?
Yeah, it's very common for, it's not just athletes, it's everyone, for there to be a lot of tightness on the outside of their lower leg, even up to, the IT band. It's what we call our lateral line of fascia. And so that does tend to wind a little bit tighter for a lot of people. More than likely, she might have flat feet and need some support, maybe on the bike, maybe in her shoes. But she probably also has a weak gluteus medius. So I'd give her those exercises as well.
Okay.
I'm curious if this is a thing that people get sometimes. I've never had this happen before, but my left elbow, it's the arm that I reach down for my water bottle with. In the last month or two, the outside of the elbow has been feeling sore, almost like tennis elbow, but it's not bad, but I don't want it to get worse. Is that the motion of reaching down for the water bottle with the same hand every time?
So it could be contributing to it, right? It doesn't sound like if you press on it, it's real sharp and painful.
No.
So there's no bursitis or tendonitis or anything like that that's happened. More than likely, you're pulling out with your arm rather than pulling that shoulder blade back as you bring it back. Now, whether your thoracic spine has a hard time extending or rotating along with that, I can't speak to that, but I would think about when you're doing things, even just picking something up off the ground, think about pinching that shoulder blade and retracting that shoulder back rather than trying to do it from your wrist or from your arm out.
Okay.
And see if that helps. But then I know you're doing the strength training program, so you're going to get all the strengthening from the retraction exercises that are on there.
Thank you.
You're welcome. But when you're doing any kind of the exercises, just make sure you're really thinking about pinching those shoulder blades before you bring those arms out. Just focus on that.
Okay.
And so that kind of goes with that lateral line question that Jim was asking too, because that line is all the way up to the side of our heads.